Hello and welcome to the Awareness Factory, the place where we look critically at what is going on in the world. And right now, of course, we have to look at the insanity around this so-called pandemic. And in times like this, and in face of recent events where countries have decided to go back to the old ways which already worked so well in March, April of this year, and many people are living in an induced psychosis where they do not question and do not think critically and look at the facts instead of believing what they are being told. We will do the opposite. We will think critically and we look at this cure that the governments are again introducing and whether it is worse than the disease itself and why some facts are being ignored, not looked at, and we're going down the same rabbit hole. So let's get started. Before we do that though, if you enjoy this type of content, do not forget to like, share and subscribe to this channel. It really helps us out a lot. Let's get going then and look at the facts of the cure that is worse than the disease and why. And as you remember from our last video that is titled This is Madness, which appeared on our other channel, and I'm going to link in the description box below. Dr. Navid Nabarro, the World Health Organization's special envoy on the virus that shall not be named, said that we in the World Health Organization do not advocate lockdowns as the primary means of control of this virus. And this was really an astonishing U-turn of the WHO, because before that they propagated the idea that those lockdowns and other measures such as mask wearing might be effective. And now they did a complete U-turn. And Dr. Nabarro also added in his interview with the Spectator, quote, "This is a terrible, ghastly global catastrophe actually. And so we really do appeal to all world leaders. Stop using lockdown as your primary control method. Develop better systems for doing it, work together and learn from each other. But remember, lockdowns just have one consequence that you must never ever belittle. And that is making poor people an awful lot poorer." End quote. And now, very recently, another WHO top official, Hans Kluge, the World Health Organization's regional director for Europe, echoed his colleague's statement in a recent interview with Euronews. He said that governments should stop enforcing lockdowns unless as a quote-unquote last resort because the impact on other areas of health and mental well-being is more damaging. So he's clearly saying here the cure is worse than the disease. The interviewer, Darren McCaffrey, tweeted, quote, he says, "Damage to other health areas, mental health, domestic violence, schools and cancer treatment is too great." And we're gonna look at the facts and see whether those top WHO officials are correct in their assessment. And it turns out that yes, they are correct, and not only that, it is in line with what numerous other experts have said since May. These solutions, the lockdowns, the border closures, the contact tracing, the mask mandates, they are not backed by any solid scientific evidence, and they will end up killing more people than the virus itself. Germany's Minister of Economic Cooperation and Development, Gerd Müller, also recently warned that COVID lockdowns will result in quote-unquote one of the biggest hunger and poverty crisis in history. He said, "We expect an additional 400,000 deaths from malaria and HIV this year on the African continent alone, adding that 500,000 more will die from tuberculosis. We also had recently a leaked study from inside the German Ministry of the Interior, and this study found too that the impact on the country's lockdown could end up killing more people than the coronavirus due to victims of other serious illnesses not receiving treatment. Richard Sullivan, Professor of Cancer and Global Health and Director of King's College London Institute of Cancer Policy, warned also already in May, quote, "The number of deaths due to the disruption of cancer services is likely to outweigh the number of deaths from the coronavirus itself over the next 5 years." Peter Nilsson, a Swedish professor of internal medicine and epidemiology at Lund University, said also, quote, "It's so important to understand that the death of COVID will be far less than the deaths caused by societal lockdown when the economy is ruined." We also had a data analysis consortium in South Africa who found that the economic consequences of the country's lockdown will lead to 29 times more people dying than the virus itself. Experts have also warned that there will be 1.4 million deaths globally from untreated tuberculosis infections due to lockdowns. And the data gets worse because we can also clearly see that those measures not only cause harm to our physical health but also to our mental health. Medical studies have shown over the years clearly that excessive stress and anxiety, as it is right now induced by the mass media and our governing bodies, are among the most debilitating and deadly of all health hazards in the world. Beyond their obvious effects like suicide and substance abuse, these mental stresses are strongly related to and may trigger and inflame a host of ailments like high blood pressure, digestive disorders, heart conditions, infectious diseases, cancer, and pregnancy complications, amongst others. Based on a broad array of scientific data, Just Facts computed in May that the anxiety created by reactions to COVID, such as stay-at-home orders, business shutdowns, media exaggerations, and legitimate concerns about the virus will destroy at least 7 times more years of human life that can possibly be saved by lockdowns to control the spread of the disease. They also went on to say that this figure is a bare minimum and the actual one is likely more than 90 times greater. 90 times greater. Scientific surveys also of US residents have found that the mental health of about 1/3 to 1/2 of all adults has been substantially compromised by the reactions to this so-called pandemic. The US Substance Abuse and Mental Health Services Administration also recently came out with another terrifying statistic. They looked at percentages of young people between 18 and 25 who have considered suicide. And normally this number is between under 7% and 11% for 12 months. And now they found out that just in June, so not in 12 months, just in 1 month, it was over 25%. And while the poor get poorer, more people go hungry to bed every day around the world, people are losing their businesses, more and more people fight for unemployment. You know what else has happened? The rich have gotten even richer. As you can see from these headlines from Forbes magazine and Business Insider, these shocking charts show just how much richer billionaires have gotten since COVID. Another one from April, billionaires are getting richer during the pandemic while most Americans suffer. From Business Insider, how billionaires got 637 billion richer during the coronavirus pandemic. So billionaire wealth has boomed. This is not a theory but a fact. And while, for example, in the US alone, 40 million people have filed for unemployment, those people are doing better than ever. Maybe it is designed this way. Maybe this whole so-called pandemic is not about health at all, and all of these measures are not to protect the public. Maybe this is about something much more sinister. The manipulation of the population, a brainwashing operation, a power grab, total dependency on governments, big corporations, the International Monetary Fund, the World Bank, a wealth transfer as we have seen, a great reset as they like to call it. They also like to call it the fourth industrial revolution, and we're going to talk in future videos about what they themselves say about a great reset and this so-called fourth industrial revolution. Maybe it's about a war on humanity. Maybe it's about tyranny, a depopulation agenda, a total remodeling of society, a technocracy, a transhumanist society, complete surveillance, complete control. Maybe this is the new normal that you hear the mainstream media always talking about. Well, I leave it up to you. This is food for thought. Comment in the comment section below what you think about this. And I would like to leave you on a high note. It's not all doom and gloom. There are also some good news from around the world, because it seems that more and more people are waking up, as can be seen by the recent protests which are still ongoing around Europe, in all the major European capitals, but also in Canada, in Israel, etc. As you can see from the pictures here, in Berlin alone, not even a month ago, there were hundreds of thousands of people protesting the government measures for this situation. And as we have seen, those people have a point, because even the World Health Organization has spoken out against lockdowns. We know now from a lot of experts and data analysis that the price that we have to pay is way higher and way outweighs the potential benefits of these measures. We know also from comparisons between what countries did during the March and April peak, that it did not have a negative impact for those countries who did not implement lockdowns and border closures and mask wearing mandates. So the people are demanding answers, and more are getting fed up with this insanity, because as Albert Einstein said, repeating the same thing over and over again and expecting a different result, this is the definition of insanity. And this is what the governments seem to be involved in right now. They try the same methods which were already unsuccessful the first time around and expect a different result. But don't get too comfy, because in my opinion this fight has just begun. I urge you to leave your differences behind and join the movement for freedom, for liberty, for humanity, and for solutions that work and where the price is not higher than the potential benefit. With all that being said, I hope that you've enjoyed this presentation. Please get involved in the comment section below and tell us your opinion on this whole so-called pandemic and the measures, whether you think they are motivated by health concerns or other motives. Always stay aware and think for yourself.